Thank you, Rich. Good morning, everyone. My name is Dr. Allison Arwady. I'm the Commissioner at the Chicago Department of Public Health. This morning, the CDC announced confirmation of the second case of novel coronavirus in the U.S. and the first in Illinois. The patient is a Chicago resident, and my team at the Chicago Department of Public Health is working in close coordination with the CDC, the Illinois Department of Public Health, the Cook County Department of Public Health, and many other partners at the local, state, and national level to ensure a coordinated response. I particularly want to thank Mayor Lightfoot and her office, who have been in constant communication and fully engaged in supporting our collaborative efforts to keep the public safe and informed. I will tell you some more about the patient in a minute, but I want to start by stating clearly that this is a single travel-associated case, not a local emergency. We obviously take emerging viruses very seriously, and there are still many unanswered questions about this novel virus. But I can reassure you that even with this Chicago case, the health risk to the general public from novel coronavirus remains low at this time, both nationally and in Chicago. Chicago has been building its public health preparedness systems for years, and we have a solid response plan in place. There is no need for the general public to change their behavior in any way based on this news. The patient is a woman in her 60s. Most importantly, I'm pleased to report that she is clinically doing well and is in stable condition. She traveled to Wuhan, China in late December and returned to the U.S. on January 13th. A few days after arriving home, the patient began to feel unwell. She called ahead to alert her doctor to her illness, rather than just presenting to a clinic or emergency department. This is exactly what any potentially ill returning traveler from Wuhan should do: call ahead and seek medical care. This patient's doctor's office appropriately asked about travel history and quickly put a mask on the patient, helping limit the potential risk of spreading infection. Her doctor then referred her directly to a hospital with infection control capabilities for further workup. Again, this is exactly what we've been educating local healthcare providers to do. Ask about travel history and reach out to your local public health department to discuss any ill patients with recent travel to Wuhan, China. Hospital staff then placed her in the appropriate setting for infection control, performed a full clinical workup, including ruling out more common viruses like influenza, and worked with public health to arrange testing for novel coronavirus at CDC. The patient is clinically doing well. She is currently in stable condition and remains hospitalized primarily for infection control. While we will be following her course closely, the patient's story so far highlights the way public health messaging and awareness are working locally, as well as the importance of coordination and awareness in the clinical setting. The patient has been very helpful as we've been gathering information about her contacts in recent days. She was not symptomatic when flying. And based on what we know now about this virus, our concern for transmission before symptoms develop is low, so that is reassuring. She has limited close contacts, all of whom are currently well and who will be monitored closely for symptoms. We will also be monitoring the healthcare workers who have cared for and continue to care for this patient. Since returning from China, the patient has had very limited movement outside her home. Now that this test is positive, we will continue to collect and confirm even more information about her activities and contacts. But we know already, for example, that she has not taken public transportation. She has not attended any large gatherings. And actually, to our best knowledge at this point, she has not had extended close contact with anyone outside her home since returning from China and prior to admission to the healthcare system. So this is all very reassuring in terms of infection risk to the general public, which again remains low nationally and locally. Anytime a new virus emerges, we are reminded of how small our world is and of how critical it is to invest in building strong public health systems. I want to thank the federal, state, and many local partners who have worked together and prepared, not just to respond to this case, but over many years to ensure the Chicago area is well prepared to respond to emerging infectious diseases.